Today I will be doing my informative speech. This is my audience tonight. I will be doing mine on breast cancer. What is breast cancer? Breast cancer occurs when abdominal cells grow out of control in one or both breasts. They can invade nearby tissue and form a mass called malignant tumor. The cancer cells spread, metastasize to lymph nodes and other parts of the body. Breast cancer is women's worst fear, but experts have made progress in cancer. If they're found early, breast cancer often can be cured, and it is not always necessary to remove the breast. What causes breast cancer? Doctors do not know exactly what causes it, but there are some symptoms and some risk factors. Being a woman is one. Getting older is another. Gene changes, your race and ethnicity. Having history of radiation treatment to the chest. There are also risk factors that you may be able to change using therapy or the having menopause. Lack of physical activity, being overweight or obese, not breastfeeding, not having children until after the age of 30, drinking alcohol beverages, but many women who have risk factors do not get breast cancer. And many women who get breast cancers do not have any known factors other being females and getting older. What are the symptoms? Number 1, unexplained weight loss. Many women would be delighted to lose weight without trying, but unexplained weight loss, say 2 pounds in a month without an increase of exercise or a decrease in food intake, should be checked out. Number 2 is bloating. Bloating is a common for women that just live with it, but it could point to ovarian cancer. Other symptoms of ovarian cancer include abdominal pain or pelvic pain. Number 3 is breast changes. If you have a change, you're expected to go see a doctor to take a careful history exam on the breast. Number 4 is between period bleeding or other unusual bleeding. But between period bleeding, and especially if you're typically regularly check it out. Your doctor will take a careful history and depending on the timing of the bleeding. Number 5 is skin changes. Your doctor will take a careful history depending on the timing of the bleeding and other symptoms. Probably order of ultrasound or biopsy. Number 5 is skin changes. Most of them known to look any changes in moles or a well-known sign of skin cancer. Difficulty swallowing is number 6. If you have difficult swallowing, you may have already changed your diet, so chewing isn't so difficulty. Turning to soups or liquids, such as a protein shake. Number 7 is blood in the wrong place, blood. If you notice blood in your urine or your stool, assume of colon cancer or coughing. Number 8, gunning, abdominal pain, and depression. Any women who gets a pain in the abdomen and feeling depressed needs a checkup. Number 9, indigestion. Women who have been pregnant may remember the indigestion that occurs as they gain weight. The indigestion, for many apparent reasons, may be a red flag. Number 10, mouth changes. Smokers should be especially alert for any white patches inside the mouth or white spots on the tongue. Number 11, pain. Also, some people complain of various aches, pains, but pains vague. It may also be an early symptom of some cancer, although most pain complaints are not from cancer. Number 12 is change in lymph nodes. If you notice a lump or swelling in lymph nodes under your armpit or in your neck or anywhere else, it could be worrisome. Number 13 is fever. If you have a fever that isn't explained in the influenza or any infection, it could point to cancer. Fevers more often cancer has spread from original sites. Number 14, fatigue is another vague symptom that points to cancer, as well as host of other problems. Number 15 is persist cough. Cough are expected with colds and flu. Allergies sometimes are side effects of medications. How is it treated? Most people have breast cancer have surgery to remove the cancer. But the surgeons may also have a lymph nodes under arms to find out if the cancer has spread in any other area. Depending on the stage of cancer, you may have a choice of surgery to remove from the breast, or you will need to have several weeks of radiation after surgery. Surgery is to remove the breast. If you choose mastectomy, you can have an operation to make a new breast. Can breast cancer be prevented? You cannot control some of the things, but the risk factors that for breast cancer, such as gender and age, but you can change others to stay healthy as you can. Eat healthy diets with a lot of fruits and vegetables and whole grains. Make exercise a routine for your life. Stay as healthy weight. Getting regular exercise and watching what you eat can help. Try to do 2.5 hours a week of moderate exercise. Exercise between 30 minutes a day. After a menopause, even having having a drink a day or less increase the risk of breast cancer. If you have a strong family history of breast cancer, ask your doctor about genetic testing or a blood testing and check out the changes of the genes that increase in your chance of getting breast cancer or ovarian cancer. There are top 10 benefits of physical fitness. One is you are more likely to live a long, healthy life. You'll have more energy, strength, and stamina. You keep excess body of fat. You'll keep your bones strong. You'll prevent or reduce back pain. You'll keep your mind sharp. You will improve your mood. You'll get less sick, and you'll have a better sleep. And you'll enjoy more time of life. This concludes my presentation of breast cancer, and I will also show you the food pyramids of fats, milk, vegetables, and lean meat and fruits, like for each serving, and how the food pyramid has for the different dairy products what percentage of you have to eat, the lean meats, the fruits, the breads, the fat and sweets, and what your your calories limit to, depending on your age, and helpful hints of how it will help you on your sugar and your food pyramids, and also how the FDA has nutritious facts, labels on how for you to learn about the nutrition facts, the serving size, the calories, the the nutrients, and the percentage that you should intake on a daily basis. And these are like little footnotes of how you can start checking out the calories and how to limit them for each one. And the serving size also is important on how to stay healthy, and the calories.